Welcome to Lifestyle Med with Dr. Jade. Health, it's a lifestyle. Hey family, and welcome back to Lifestyle Med with Dr. Jade. And this is a highly requested video about marijuana. I have been avoiding talking about medical marijuana because there's still so much research to be done, you guys. The research is not that strong on the health impacts of marijuana, especially in use of medical marijuana, but I've just gotten so many requests that at this point I just have to tell you guys where we are in research now. And if there is a hot topic, medical marijuana for sure is a hot topic, all right? And so I am no medical marijuana expert, but I do know the research that is out there. I've read it in detail, and I want to tell you the top 5 negative health effects that marijuana has that we know in research right now. Are you new here? Then welcome. I'm Dr. Jade, and on this channel, we talk all about fitness, nutrition, primary care, hot topics like this one. And if you're interested in just getting one step closer to your optimal level of health, take a look around the channel. Give this a video a like if you enjoy the content. Also subscribe and hit the bell. Share with friends that you think would also like to get healthier and talk about health-related topics. And join our fam here on YouTube and on Instagram at Dr. Jade MD. And there has not been a robust amount of scientific research on the health effects, the health benefits, and the detrimental health effects of chronic ongoing marijuana use in our medical research to this point. We believe that we should have more research in the future now that there is this legalization of marijuana happening worldwide, especially nationwide. But as of now, the research is, I would say, minimal in comparison to other substances that we have studied more in depth. But I will share with you the top 5 things that we know now on the negative effects of health when it comes to chronic marijuana use. Number 5 is an increase in fatal motor vehicle accidents. So this is an interesting one. So there were 19 published articles that were actually trying to research the negative health effects of marijuana, of health in chronic marijuana users. But what they actually found was there was a trend in the number of fatal car accidents or motor vehicle accidents in people that were under the influence of specifically marijuana. And so although people don't often think of this as a health complication, but motor vehicle accidents, deaths from motor vehicle accidents are increased in our medical research, evidence-based, that there is a link to more fatal motor vehicle accidents in people who are under the influence of marijuana. And number 4 is a lower educational attainment. This is specifically studies that were done in adolescents or teenage age group. And there were 16 longitudinal prospective studies that were conducted that showed that the adolescents or teens that were using marijuana tended to either not graduate high school, not graduate college, or just obtain a lower level of educational status or degrees than those who did not use marijuana in their teens. Now we know that there are plenty of people who use marijuana in their teens that completed degrees, that completed high school, that are, very smart and have attained all the things in life that they hope to attain. But I'm just sharing the research that in 16 published prospective longitudinal studies, the trend showed in evidence-based medicine that there was a trend of what they call amotivational syndrome, or obtaining a lower level of education in those teens that were using marijuana compared to the teens that were not. Number 3 is an increase in lung irritation, and that is increasing in cough, sputum production, or that thick mucus, and just the overall irritation of the lungs. However, in our research so far, there is not a clear link to marijuana use and lung cancer like we have with tobacco use. There's a clear link of lung cancer with tobacco use. Right now, our research is not evident or consistent or proven to show a clear link between marijuana and lung cancer. However, there is a clear link between marijuana use and lung irritation, and people who have any type of underlying lung disease or pathology like COPD or asthma or any other type of lung problems when they are smoking marijuana. The studies do show that this helps to worsen those symptoms or those medical problems by compounding basically and irritating the airways even more. So if you have any type of lung problems, or you notice you have more airway irritation, mucus, cough, or you have any type of lung disease and you're smoking marijuana, just know that doing those together are going to make the lung irritation worse. Number 2 is something called hyperemesis syndrome. So hyperemesis means more vomiting or lots of vomiting. And this is a relatively rare syndrome, but there is a syndrome that you can get, or that a small percentage of chronic marijuana users get. And the research showed that these were marijuana users that were daily or frequent marijuana users for over a year. A small percentage of them had recurrent or frequent nausea and vomiting and upset stomach. And when they stopped using marijuana, the symptoms resolved within 2 to 3 days. So if you're a person who uses marijuana often for long periods of time, and you notice that you have issues with recurrent or frequent nausea, vomiting, bloating, upset stomach, then you can try stopping or decreasing your marijuana use. That's going to be the first thing your doctor is going to suggest, because you could have hyperemesis syndrome. And number 1 is infertility. And the evidence is very strong for this one, that there is a clear link between chronic marijuana use and a decreased sperm count and sperm concentration in men. When we have couples that are trying to get pregnant and trying to conceive and they're having a hard time, one of the first things we're going to ask is about marijuana use in the male, because there is a clear link to marijuana use and decreased concentration and potency of sperm, leading to infertility. So I hope you guys enjoyed the top 5 negative health effects that we know right now in our research when it comes to marijuana use. There is so much more research that needs to be done, okay? But I'm happy to share what we know so far, since I have gotten so many requests on marijuana and health. But what I do want to end on with this video, very serious, is that I'm happy to see in the research and in the executive statements of multiple health organizations, including the American Academy of Family Physicians, that although we as physicians and health organizations, they are not supporting marijuana use, just because we do see that there are some negative effects of marijuana. But what the health organizations have made executive statements stating clearly is that they are in support of decriminalizing personal use of marijuana. So in support of not arresting and imprisoning people for the use of marijuana for personal use. And I stand by that I am so excited to see that the decriminalization is being decreased, although we can't promote it necessarily because there are some health links. But these are the top 5 things that we know right now about negative health impacts on long-term marijuana use. All right, guys, I hope you enjoyed this. I will see you next week on Wellness Wednesday. Let me know what other topics you want to talk about in health, fitness, nutrition, primary care, hot topics, and I will see you next week. Bye. If you enjoyed the music on this channel, make sure to check out the description box for your own custom music by C Major Nation. And as always, be sure to like, comment, share, and subscribe. Thank you, and God bless.